Good afternoon, and thank you for joining us here as we talk about COVID-19 and the pandemic in Erie County. Today we have 53 new cases of COVID-19 to report within Erie County, and unfortunately, 2 additional deaths. So since last Wednesday, we've had 373 new cases and those 2 additional deaths. As of this morning, there are 23 total hospitalizations within the hospitals of Erie County, and 2 of those individuals are on ventilators. The positivity rate for Erie County was 7.5% for April 9th through 15th, according to the Pennsylvania Department of Health. So I continue to encourage everyone to get the vaccine and help us truly control and eventually eliminate this virus in Erie County so that we can rebuild our community at a safer, stronger, and healthier pace. I'm speaking to all residents, but especially to those in the younger generations right now. Younger than me, but those particularly in the teens, 20s, 30s, and even 40s. Your family needs you to get vaccinated. Your local businesses and organizations need you to get vaccinated. Our schools need you to get vaccinated. In fact, our entire community needs you to get vaccinated. Because right now, everyone who's aged 16 and older is eligible to receive the COVID-19 vaccine here in Erie County. Appointments are available across the county. Many offer even that you can just walk in. You can find many of the locations at eriecountypa.gov under our COVID-19 pages under vaccine. And as a reminder, the vaccines are absolutely free to every resident of the United States. And insurance is not required. So if you do not have health insurance, there should be no concern. Insurance is not required to get this vaccine. And your immigration status will not be asked. As I said, this vaccine is available to everyone 16 and older who is a current resident of the United States. This is a national resource and therefore available to all. I would also encourage you to get tested if you haven't been able to be vaccinated yet, particularly, and have some symptoms that are COVID-19, or if you have been vaccinated and have those symptoms. Because we know the vaccines are very effective, but again, we're talking 95% effective, which means 5% of the people could still get COVID-19 after being vaccinated. The health department now has mobile testing hours and will be at the following locations this week. Tomorrow, from 4 to 8 p.m., out in front of the Blasco Library. Saturday, April 24th, from 10 in the morning to 2 in the afternoon at Harbor Creek Junior High School. And then from Monday, April 26th, from 10 to 2 p.m. at St. John the Evangelist Church, I believe in Girard. And so there will be many, many more locations. We're trying to get them out into the entire community. Just the other day, we were at the casino up in Summit Township, and we have been out in Wattsburg. And again, we hope to be bringing this mobile unit to a community close to you. So thank you again for helping us control COVID-19 by getting vaccinated, getting tested, doing what you need to do to help mitigate the spread of the virus within Erie County. And now I'd like to bring on our guests for today. First, I'd like to bring on Shar Behringer from the Erie County Department of Health. Shar?
Yes, thank you, County Executive. Good afternoon, everyone. As I promised last week, I am providing an update on the unaccompanied minors that are located at the Pennsylvania International Academy. The Erie County Department of Health is in regular communication with federal staff at the location and the PA-DOH partners that are assisting the site with both COVID and childhood vaccine topics. From the COVID aspect, Erie County has received 12 reported cases of COVID-19 disease at the facility. These 12 are part of the daily numbers that are reported by ECDH by the Erie County Department of Health in the last week. The site tells us that there are another 21 cases that have not yet been reported into the Pennsylvania Electronic Disease Reporting System. The Erie County Department of Health is working with the site to facilitate that data entry. The appropriate isolation and quarantine procedures are in place under the direction of the federal medical staff that are deployed to the site. At this time, there is no additional risk to our community. Childhood vaccines are also being addressed. It's assumed that these children have not had any childhood immunizations, as there's not any immunization records available for them. Based on the site staff's experience with similar settings, the measles, mumps, rubella, and varicella, varicella is the chickenpox vaccine, has been prioritized to be administered first. The Pennsylvania Department of Health staff will be administering that vaccine. Plans will follow to address the remaining childhood vaccines like tetanus, diphtheria, pertussis, polio, hepatitis B, and meningococcal vaccines. Thank you very much, County Executive.
Thank you, Shar, for that update. And of course, Shar will be available for questions with the media. And now Dr. Howard Nadworny, as everyone knows, infectious disease physician who has been consulting with the health department since the beginning of the pandemic, will share a few words. Dr. Nadworny? You're muted, Dr. Nadworny. You're muted.
Thank you, County Executive. I wanted to report that both the wastewater testing in the community and the actual case identification rates have been increasing over the last several weeks, indicating that there's increasing spread in the community. BioBot, the company that does our wastewater testing, has been doing qualitative testing for the B117 variant and has reported for the last 3 weeks that we have had the B117 variant in our water. And starting next week, they hope to be able to give us a quantitative test for it to give us an idea what proportion of our virus is due to that strain. We suspect that there's an increasing amount of that because it's been spreading more, but it's also becoming clear that this pandemic is being spread and supported primarily by people who are not immunized, who are not masking, and who are gathering in groups, whether that is at bars or restaurants or gyms or booster clubs or other community gatherings. The people who've been immunized are getting disease at a very low rate, and the people who are wearing masks and socially distancing have really not been part of case identification or disease investigation. So it is increasingly the responsibility of those people to get vaccinated because that's really the only way that we will interrupt this spread. And even though we're seeing fewer older people getting sick, we are still seeing older people admitted to the hospital and dying. And a lot of that is because they have contact with younger people who are the ones who are spreading it. In addition, we are also seeing younger people who are developing complications of COVID, whether that is pulmonary emboli or blood clots, brain fog, chronic fatigue, pulmonary fibrosis. COVID clearly causes a lot of complications, even in young people, that can last for weeks and months. So this is not a benign disease, but the only way to really safely protect the community is really for everyone to get vaccinated, because at this point, the only safe gatherings really are among those people who've been vaccinated. So as the county executive recommended, I would also encourage everyone to get vaccinated. The vaccines are very effective. We have found that people tolerate them quite well, and they work. Thank you.
Thank you, Dr. Nadworny, and we will take it now to the media for questions. And today we're going to start with Talk Erie. Joel.
Yes, thank you, County Executive. Appreciate it. Question for Shar. Shar, with the children up at the Summit Township dorm, we're talking about a total of 33 cases out of 147 children. That's a pretty high ratio there. What are some of the protections that the adults are doing to not get themselves infected, or on the federal level, and the people that are staying in our hotels and places around the dorms?
Sure. Yeah, thank you for that question, Joel. There is medical staff that is deployed to that location. They are equipped with the appropriate personal protective equipment, PPE, that is required, and they are working with the other staff in the use of that where it is appropriate. So they are taking all the appropriate infection control measures, so they're not taking it back to their hotel rooms or to anywhere else that they are going in our communities.
And just quick follow-up, would you say it's too early to know whether these are variants that are present in these positive cases coming from Central America?
We probably won't know that. Variant testing in Pennsylvania and in our country in general is still pretty spotty. In fact, as a discussion this morning with the State Health Department, they are going to stop reporting to us the variants related to the UK, the B117, because they're assuming that that is basically most of what we are seeing circulating in Pennsylvania at this time.
Thank you.
Thank you. Erie News Now.
Hi, a question for Shar. As we look at hospitalizations, which have risen steadily over the last few weeks here in Erie County, what can you tell me about the demographic data of those people? Is it still largely older people who are being hospitalized, or are we seeing an increasing percentage of people, say, 50 and younger?
Okay. I do not have any information on hospitalizations. Dr. Nadwarny may be able to speak to HN, but I do not receive hospital data.
Doctor, can I throw that to you then, sir? Do you happen to know anything about ages of people being hospitalized?
I actually don't. I don't get that information either. I can anecdotally tell you from rounding, but I don't really know the global numbers for the people being hospitalized in terms of their ages.
Okay. In that case, can I shift gears on you here? Would you address vaccine hesitancy? We talked with people at a clinic today who said that they're down considerably in terms of what they're able to give people in terms of available doses to those given out. What are the next steps? How do you get out into especially rural communities and convince people to get the vaccine?
Okay, that question came through very garbled. I'm not even sure who it was directed to.
All righty. I hope this is better. Shar, we saw today, we talked with a clinic that said that they weren't giving out nearly as many doses as they had available. So what's the next step? How do you try to get people, especially in more rural areas, to get this vaccine?
Okay, I believe the question is related to vaccine hesitancy. Is that correct?
Yes, that's correct.
Okay. Yes. At this point in time, our vaccine team is working very diligently in identifying sites outside of the metro area where vaccines will be offered. They are also looking at possibly changing the times that they are offering. So for people who are working during the day, scheduling some late afternoon, early evening clinics. We have work going on with our community health workers as far as community education to some of our highest risk and most vulnerable populations. I hear a lot of one-on-one going on also with, just family and friends encouraging their family and friends to go get the vaccine because they want to be able to socialize with them. So efforts are being made, and certainly our community partners between MCIC and Allegheny Health Network are integral in those plans.
Thanks.
Thank you, Ethan. And we'll now go to Jet TV.
Hi, County Executive. It's Brian Wilk. My question is, I guess, last week's update, I guess, kind of reiterating, you mentioned that a lot of younger people teens, 20s, 30s are high rates, and now, anyone over the age of 16 can get a shot. Can you just reiterate how important that is for people to get vaccinated and your message to those younger people?
So, many younger people, I believe, think that, they're not going to, if they get COVID-19, or maybe they've already had it, it hasn't been that big of a deal for them. But what we do know is there are a percentage of people of all ages where it is a big deal. Dr. Nadworny alluded to that with the long hauler syndrome, as we call it. Of course, we have lost young people as well as older people, although the deaths have certainly been more prevalent in older individuals. But this virus is serious. The other thing I think that's important to remember is no one who's under 16 can get the vaccine. So by you getting the vaccine, if you're 16 and up, you actually are protecting our children, allowing our schools to stay open. Probably most school districts in Erie County, I can't say for sure 100%, but have had to shut down at some point because of the number of cases within the school, either shut down a whole grade or a few classrooms. But again, the children then back to remote learning. So by you getting a vaccine, you're helping to protect our children and that education that's so important. You're helping to protect our most vulnerable, because there are some people who have specific illnesses who, for that reason, are not able to get a vaccine. So by you getting a vaccine, you're protecting them. So just like in the beginning, we talked about, the mask being for the community, that you were actually helping to protect all by wearing your mask. By getting a vaccine, you're not just doing it for yourself, you're doing it for all of those people that you might come in contact with who maybe for various reasons, age, being young, or for other health reasons are not able to get the vaccine. So I ask you to consider doing this for everyone and to remember that the vaccine is safe. We have Moderna and Pfizer available in Erie County, and the safety of those vaccines, I think, has been shown over millions and millions of doses that have been given out across the country and across the globe. Thanks, Brian. We'll go now to Erie Times News. David.
Yes, Kathy, thank you. This question I believe is for Shar. With younger people getting confirmed cases of COVID, have we seen an increase in Erie County schools having to go to remote learning in the last few weeks? Have we seen, do you have a count for how many? Have there been any?
Okay, David, I'm sorry. That was also very garbled.
Okay. Shar, have you gotten an increased number of schools having to go to remote learning as younger people are getting COVID in recent weeks?
The number of schools that need to go to remote learning for X amount of time really varies from week to week. I believe currently there's one district that, if they get a couple more cases, will need to go. There's another district that has expressed that, or another school, I should say, that has expressed concerns that their cases are rising. But I do not have specific numbers there.
And then a follow-up for Dr. Nadworny. With nearly 100,000 Erie County residents having at least one dose of vaccine, when do you expect to see a tipping point where the number of vaccinations really impact the number of cases and we see a decline?
Well, David, given the fact that we are seeing still an increase in cases, it's clear that there's a large group of people who are being socially active and not using masks who haven't been vaccinated yet. So I would probably suspect that we need a doubling of the number of people who've been vaccinated compared to now for us to really see a control of this. Because clearly there are a lot of people who are exposing other people to their infection who've not come in to get vaccinated. I think a lot of the problem is that most people who get COVID get mild symptoms. They're allergy-like, their stuffy nose, their headache and sore throat, their fatigue and maybe a low-grade fever. And I think a lot of younger, healthier people think that it's not either a true illness or it's not important enough to do anything about, but those are the people who don't take precautions and then spread it. So I think until we get a large enough group of the 20, 30s, and 40-year-olds vaccinated, I think we probably will continue to see spread, because I think that people are getting tired of using masks, even though that still works the best. So my suspicion is we'll need a lot more people vaccinated, maybe a doubling of what we've completed so far, before we really see better control. At least I hope we see better control. My worry would be that as we see more variants, the people who haven't been vaccinated, who perhaps got COVID last year, become susceptible again to these variants. So instead of having both vaccinated and previously infected people protected, the previously infected people are still susceptible. So that's the other reason why vaccination is so important.
Thank you.
Thank you. I'm going to kind of go off script, and I'm going to ask Dr. Nadworny a question, because I've had this issue brought up to me twice in 24 hours, where someone got the vaccine, didn't realize they were actually an active COVID-19 case at the time, thought their symptoms were from the vaccine, but then realized they were from the actual virus infecting their body. So maybe there's a time limit if you have some symptoms after the vaccine, that it goes on for so long you should actually be tested for COVID-19. And I just wanted to ask you, Dr. Nadworny, if that is true.
Well, in fact, when you get your first dose of vaccine, you don't really develop levels of immunity for 10 to 12 days after the first dose. And you are only about 70 or 80% protected by the time of the second dose, after which it takes another 2 weeks to get up to that 95% level. So it's very common in areas where there's a lot of COVID spread for people who got their first dose of vaccine to get sick in the week after, because they were already exposed. So that's not at all surprising. That's why it takes 5 weeks after the first dose of Pfizer, 6 weeks after the first dose of Moderna, to really say people are fully immune. It happens quicker to some degree, but I have seen a number of people who got infected after their first dose, but before their second. They just don't have enough immunity in that time period when they got exposed.
Thank you. Thanks for answering that question. I think that's helpful to people. We'll go back to Joel at Talk Erie.
Thank you. Another one for Dr. Nadworny. Doc, with many hospitalizations now with people under 65, can you speak to the underlying health problems people are presenting with at the hospital? It's been reported that obesity or body mass index over 25 is a chief contributor to COVID complications. Is that what you're seeing here in Erie?
Yes, but we're also seeing people who have chronic lung disease who get COVID, and that makes their chronic lung disease that much worse. It does tend to be more common in people who are overweight. It tends to be a little more common in people with kidney disease pre-existing and lung disease, but it's a wide range of people.
So you're not seeing the national trend that that obesity is maybe a chief complicator?
Oh, I think we see it as a higher proportion of our cases, but it's not exclusive for COVID. So we see a lot of COVID patients who aren't obese. I think part of the challenge is that a large proportion of the population is obese to begin with. So it's not surprising that we're going to see more people. Obesity is clearly a high risk factor for many complications, and I think we're seeing that here. But I'm just making the point that just because you're not overweight doesn't mean you couldn't get a severe case of COVID. We've seen a number of people who were quite healthy before they got COVID and then got a severe case and ended up on a ventilator. So even though the trend is, yes, people who are obese are at much higher risk, and certainly those people would be a very high priority for vaccination, we're seeing it in a lot of other people as well.
Thanks so much.
Thank you. Ethan with Erie News Now.
Hi, a question for Dr. Nadworny. Doctor, how concerned are you about the rise in hospitalizations? If memory serves, it was 2 weeks ago we were at just 6 hospitalizations, a week ago 15, now 23. How concerned are you?
Oh, I'm very concerned. Hospitalizations tend to lag several weeks behind increase in cases, and we still have a significant number of elderly people who have not been vaccinated. And we also have people with chronic diseases that may not respond as well to vaccines. A lot of people that I have either taken care of or heard about got their COVID infection from exposure to a younger person, either coming in to help take care of them or visiting them. And so I think that I worry that our hospitalization rates are going to continue to go up as this virus continues to spread. We may have not as high a proportion of people dying or as high a proportion of people getting hospitalized because of the number of people who've been vaccinated, but we clearly are way below the levels that would make us say, okay, it's not going to be a severe disease anymore. There clearly are a lot of people at risk of getting severe infection and getting hospitalized, even now with the people who've been vaccinated. It's too early yet.
Thank you, Doctor.
Brian with Jet TV.
Hi, yeah, this question's for Shar. You had mentioned, I believe, that the migrant children in Summit Township, the first priority is getting them vaccinated for, like chickenpox and mumps, things that they would not have gotten back where they lived earlier.
Yes, that is correct. Again, the federal staff that is there, this isn't their first rodeo. They've been in similar situations before, and they know that when there's a gathering of children of that size, there's significant risk, not just for COVID, but also for things like chickenpox or measles or something like that. So that is why that combination vaccine that contains measles, mumps, rubella, which is the German measles, and varicella, which is the chickenpox, that's the priority to be administered first for these children. And it's based on the experience from the federal staff.
Can I make a comment? All of those viruses are spread by the respiratory route, and they are very common in crowded situations among unimmunized people, very much similar to COVID. So those are always the highest priority for children without proof of vaccination, because it's very easy for one of those children with any one of those infections to spread it among all of the other people there.
Thank you.
Thank you.
David with Erie Times News.
Yes, Kathy. With the you said, I think, and I can't remember if it was you that said it or if it was Shar, but that appointments are appointments still required for the vaccination clinics that the health department works with, whether through with LECOM or AHN, or can folks walk into those clinics?
So appointments are always encouraged, but Shar could probably speak to this better than I, but my understanding is there is ability for walk-in, and I'm going to turn that to Shar to get confirmation on that.
As far as walk-in, I know that at least one of the clinics at the convention center this past week, they did open it up for walk-in. At the same time, if there are vaccinated people, if there are scheduled people, they're going to get priority. So we do encourage people to make an appointment if they're able to, but there's likely a decent chance that they're going to be able to get in as a walk-in also. As far as the pharmacies go, they would need to contact that pharmacy as to whether or not there's a walk-in availability or whether an appointment must be scheduled.
And then on another track, there was a mention about local vaccine distribution. Has things been ironed out for this weekend in Northeast? Or are there any other remote vaccination clinics scheduled in the next week?
Not that I have been made aware of. I've not been made aware of additional vaccine sites in the next few days outside of the metro area.
Okay. So still no firm details on where it's going to be in Northeast?
Not that I am aware of.
Okay. Thank you, Shar.
I would encourage people to continue to monitor the eriecountypa.gov website. We try to keep that up to date as quickly as we can as to where the opportunities are for vaccination throughout the community. And now we'll go back for a final question from Joel at Talk Erie.
Yes, Kathy, this one's for you. Just a little inside baseball question. Are you hearing from the state about new mitigation orders because of the rise in cases, or even relaxing mitigation orders because of, Pirates baseball or minor league baseball and some of the other events that a lot of folks are wanting to try to pull off this summer?
So I haven't heard any news of any further changes in the current limitations that are set for restaurants and for event venues, etc. But I do believe the state obviously is going to continue to monitor this. I don't really foresee them kind of going backwards and putting on further restrictions at this point, unless things really got out of control across the state. I'm going to again give a shout out to Erie County in total, and particularly to those who've worked so hard, our businesses, and they're trying as hard as they can to control this, and they need people to help them. But we don't want to go backwards, and so if people go out there and wear the masks when they go in, and keep their masks on while they're shopping, and only take it off if they're sitting down to eat, and keep themselves 6 foot distance from others, wash your hands frequently. If we all do those things, we're going to be able to keep things open and finally get to the point where we can go watch the Seawolves, and where we can go to the Philharmonic, and where we can go to the festivals and fairs. But it's really dependent on the people of this community how soon that happens.
Thank you.
Mm-hmm. And we'll go to Ethan at Erie News Now for a final question.
Hi, a question for either Shar or Dr. Nadworny. Does seeing case totals rise, seeing hospitalizations rise, how much of a damper, if any, is that putting on your thoughts and hopes for some normal summer activities in terms of seeing a more normal summer than we had last year? How much of a concern is this in terms of that?
From a broad public health perspective, it's very concerning. To have this amount of disease and to see disease continuing to increase is not at all encouraging for resuming the activities that we would like to be able to resume in the summertime in a safe manner.
So I would agree. I think that the more cases we see, the harder it's going to be to open things up in the summer. And remember that the spread of this isn't something that's out of everybody's control. We actually know what can control the spread because it has worked. And so the fact that we're seeing more spread means that not enough people are masking, not enough people are social distancing, more people are getting together without masks. And quite frankly, it's human behavior that's spreading this. So it's the responsibility of all the people in Erie County to help control this. And if they don't really participate enough, then it's going to make it much harder to have things more open. That's what's frustrating to all of us is we know what works, but people have to do it in order for it to show benefit and help everyone else in the community.
And I would like to add one more thing to that, and that's vaccinations. Now that everyone 16 and up has the ability, is eligible to go get a vaccine, if too many people choose not to, for whatever reason, and I certainly respect and understand people's concerns and maybe reluctance, but I ask people to consider the safety of these vaccines, consider the effect they have on the community, and all we have to do is look at the number of cases in people that are 65 and older compared to the number of cases that people in their teens, 20s, and 30s. We have seen a dramatic drop, and that's because lots of people that are 65 and up had the ability and went out and got vaccinated. Now it's time for the younger generations to step up and do the same for our community. And we'll go to Brian at WJET TV for a final question.
I don't have any further questions. Thank you.
Thank you. And we'll finish up with you, David, from Erie Times News.
Sure, Kathy, thank you. Dr. Nadworny, you mentioned, and we've talked about in the past about the wastewater treatment. You're hoping next week you're going to be able to get quantitative amounts for the B117 variant. Explain to us a little bit, what that will tell us. What can we glean from that, knowing how much of that variant would be in the wastewater, and how could it help us deal with this variant?
Well, that variant is associated with about a 50% increase in contagiousness and about a 50 to 60% increased risk of more severe cases. So if we have a lot of B117 in our water, it would predict that it ought to be spreading more readily, because if you're going to prevent it from spreading, you have to be even more diligent with mask wearing and distancing. The vaccines work equally well for this strain as they do for the original strain. So really being diligent about mitigation measures and getting vaccinated should work very well for this particular strain. And if we see it as a very high percentage of our population, then that would certainly fit with everything we're recommending. If it turned out we didn't have much B117, it would indicate that people are being even more casual and less diligent about precautions, because it would mean that the original strain is spreading even before B117 gets here. But the value of the wastewater testing, David, is mostly that there are other strains with other mutations that are potentially less susceptible to vaccines. And hopefully, as we go forward, we'll get the ability to test for those earlier so that we can have some early clues. But remember that for variants to show up and spread, or for variants to develop, you need lots of people getting infected and spreading them. So if people are not really diligent about masks and distancing and groups, then we're going to see more spread and we're going to see more variants. If people are really good and the number of cases go down, then we actually are less likely to see variants and see mutations that cause more trouble. So there's a double benefit to controlling this pandemic sooner rather than later, by all means possible. Vaccine, masks, distancing, hand hygiene, they all make a difference.
Thank you.
Thank you. And thank you to our media always. Thank you to my guests, Shar and Dr. Nadworny. And I'm going to finish up here with a couple of our star businesses. Last week, we were talking about businesses in Corey and out in West County. And today, we're going to talk about one in our South Central County, and that's the Creekside Bar and Grill in Waterford, where they are Pennsylvania opened and certified. There's comfortable seating with at least 6 feet between tables. In addition to indoor seating, they have an outdoor patio. Probably not great for today, but it looks like next week will be better. You can go and overlook French Creek in this beautiful patio that they have. And they have extensive, clear, and concise COVID safety signage. We thank them for all of their hard work. And finally, thanks to Romelo's Chocolates, who, again, requires masks strictly enforced when you go into their store. They have signage in place with COVID measures being taken both by the employees and asked of all those who enter. So as always, I want to thank our businesses who continue to work hard to keep Erie County safe. Again, I would put our county up against any other county in terms of the work that all have done, particularly our businesses, to help stop the spread of COVID-19 here in the community. So in the meantime, I ask you to do a few things. Obviously, wear your masks when you're out and about away from your home. Keep yourself a 6-foot distance from people you don't know. Stay out of crowds. Get vaccinated as soon as you are able to. It is free. There is no insurance required, and it's available to every person who lives in this community. In the meantime, please stay safe, and please try to help keep our community safe over this next week. Thank you.
Thank you.
Thanks. It was good.